Hi, I'm Allison Lorne, a certified nurse midwife, and welcome to this forum on holistic menopause management. I wanted to create these experiences so that viewers can write in with any questions or comments below, and I can address anything that comes up organically. I'm really curious what might come out of these sessions, what people want to know about. And I'm happy to share my own journey and studies on holistic menopause management, how I've come to manage my own menopause experience, and what my recommendations are for my patients. And um, if you'd like to follow along on my Instagram, Allison Lorne, CNM is my Instagram handle. And you can visit my website, AllisonLorne.com, if you want to learn more about me. I'm available for one-on-one appointments if you want to schedule by Zoom. And then I can really do consultations throughout the country if you're interested in doing a telehealth appointment. I'm available to write prescriptions and carry patients on my patient load in the state of California. So I have a home office here in Atascadero, California, and see patients over Zoom. So please reach out if you're interested in learning more or contacting me directly. As far as today goes, I'd like to just discuss how I have come around to using pharmacology, pharmaceuticals in my own menopause management. And it's been an interesting journey. I am an herbalist, I'm a naturalist. And so my whole career, I've always gone to herbal preparations and home remedies as my first go-to recommendation for my patients and for myself. Now, after 25 years in clinical practice, I have become very familiar with pharmaceuticals and what we use to manage women's health for everything from birth control to common vaginal infections. Um, Morning after pill, of course, is so common. We're talking about everything from treating the conditions inside the vagina to systemic antibiotic use, any of these treatments for STDs, and also my familiarity with thyroid medications, cancer treatments, patients that have come to me with pre-existing conditions and being treated for all kinds of conditions and how that intersects with reproductive health and women's health needs. So, using pharmaceuticals isn't foreign to me. I've been prescribing medications since I graduated midwifery school in 2004. Um, but like I said, for myself, I'm like very much an herbalist and naturalist. And because of this real lack of education and conversation around menopause, I myself was sort of kicking the can without even realizing it. Like I was putting off really preparing for making my own decisions around my menopause management. And then when I started getting some symptoms, then I realized like, oh, all of a sudden I'm like having to make decisions kind of quickly. And it didn't take much for me to move into deciding to use pharmaceuticals for myself. And I'm talking about hormone replacement therapy. I'm talking about estrogen therapy, progesterone therapy, and I'm actually on testosterone as well. And that's because of blood tests that show my testosterone was low. And as far as estrogen and progesterone use, we just treat based on symptoms. And when we're talking about the average age of menopause being 45 to 55 years old and perimenopause being 7 to 10 years prior, we really should be talking to women in their 30s about decisions that are on the horizon. And of course, time keeps marching forward. You're going to find yourself at some point on your journey towards menopause making decisions around managing your symptoms. Now, honestly, it's like there's so many healthcare providers that are on hormone therapy because we know we have like closer access to the data. We know the benefits of being on hormone therapy. And then we're in this really interesting time, I think, in society at large where prior studies, primarily the Women's Health Initiative and bad press, really had rolled back people making recommendations for hormone therapy. There was a lot of stigma around hormone therapy. There was a lot of fear around hormone therapy. And the media really like overemphasized a lot of negative associations with this one study that came out, the Women's Health Initiative, that showed some increased risk of breast cancer. That study really had a lot of flaws with it. One of the primary flaws was that it really didn't have an age restriction to the people that it was studying. So we had women in that study that were at a very advanced age where your risk of cancer is increasing and just higher naturally. So when we're looking at the data now and seeing when we're looking at starting hormone therapy, estrogen therapy with progesterone for those people that have uteruses, what are the risks for cancer and breast cancer specifically? We're not seeing that it's contributing to breast cancer. And there is just so much science coming out about the safety, the efficacy, the benefits of hormone therapy. So as a healthcare provider, you're like used to reading the research, these articles are in my feed. I'm seeing them come across and I'm reading them, and it's just so convincing to go on hormone therapy. So now I feel like I'm on a hilltop, like waving a flag, trying to let people know that hormone therapy is generally very safe. And I'm trying to reduce the stigma around hormone therapy, create more access to these medications that do a great job of increasing your lifespan, helping you live longer because they decrease your risk for disease. And we're talking about diabetes, osteoporosis, osteoarthritis, cardiovascular disease. There are so many benefits to taking estrogen that pretty much anybody that can take it, that doesn't have contraindications, really should at least consider taking it. And just, it's interesting to share that I'm an herbalist, I'm a naturalist, and I myself came around to realizing, oh, hormones are good for you. Hormones are good for me. And honestly, I wish I had started it sooner. Right. So I'm 50 years old now, and I had just started hormone therapy in the last few months. And I wish I had started around 45. I'll talk more about what the symptoms are of perimenopause and when we can intervene sooner based on symptoms, and why we have to use symptoms, why there's not good blood tests that can just show us exactly when to start hormone therapy and at what dose, because it's different for everybody. That average age of menopause, 45 to 55 years old, that perimenopause age 7 to 10 years prior, we're really looking at middle-aged women in their younger middle-aged women in their 30s, educating them on what's ahead for decision making. I feel like proportionately, my colleagues that are healthcare providers, there's more of us on hormones. It's easier to have that conversation than my own friends that I'm like trying to introduce this idea to. I had a craft night like 6 months ago, and I had probably 8 girlfriends over, and we're, like, making little cards and stuff, and I just said kinda out of the blue how I was reading Dr. Mary Claire Haver's book, The Galveston Diet, and it's such a great book, I totally recommend you reading it. Also, her new book out, The New Menopause, is a beautiful read. It's really accessible. I just love her voice. It's scientific without being hierarchical, if that makes sense. It's like really accessible. She's really relatable, and she presents the information in a way that's really digestible. But so I said to my group of girlfriends that I thought everybody needs to consider being on hormones. And a lot of them just looked at me like completely shocked because you wouldn't think that it's my, angle, like, it's not where I'm coming from. I have a line of tinctures, of herbal products. A lot of the patients that I see are wanting a natural holistic model. They want to try things before they try pharmaceuticals. But when it comes to estrogen and progesterone, there's just no substitute. There's nothing that's going to help you as much as being on estrogen. While I am saying that, I still have tinctures, menopausal tinctures that I encourage patients to use for everything from libido to better sleep to irritability, anxiety. Um, these herbs are a great way to support the transition of perimenopause and menopause. But the hormones themselves are really what's going to do the trick in reducing age related diseases and helping you live a longer, healthier life. So, I just hope to create a library of videos that goes more in depth into options that people have available. And as more people join lives and ask questions, I'll be able to respond directly to anything that's coming up for anybody. Today, I think with this first video, right, it's my first video, so I don't know how to necessarily like check all the windows and make sure um, anybody is or isn't asking a question right now. I don't see anything, so I hope I'm not missing you. But if you have a question and I'm missing it, then just send me an email, AllisonLauren@gmail.com. I'd love to hear from you. I'd love to make contact. It gives me more ideas of what to talk about. And also, if you're interested in a one-to-one appointment, we can set up that too. So I hope that you are having a beautiful day. Thanks so much for watching and tuning in. Subscribe and follow for more content. And I hope to revisit the live forum soon. All right. Take care.